Norethindrone is a form of progesterone, a female hormone important for regulating ovulation and menstruation. Norethindrone is used to birth control, contraception, to prevent pregnancy. Norethindrone is also used to treat menstrual disorders, endometriosis, or abnormal vaginal bleeding caused by a hormone imbalance. Not all brands of norethindrone are for the same uses. Some brands are for use only as contraception. Others are for use in treating endometriosis or vaginal bleeding disorders. Avoid medication errors by using only the brand, form, and strength your doctor prescribes. Norethindrone may also be used for other purposes not listed in this medication guide. Using this medication does not protect you or your partner against sexually transmitted diseases, such as HIV, gonorrhea, chlamydia. Norethindrone dose information. Usual adult dose for abnormal uterine bleeding: 2.5 to 10 mg orally once a day. Duration of therapy 5 to 10 days. This drug should be used when the endometrium is adequately primed with endogenous/exogenous estrogen. Withdrawal bleeding typically occurs within 3 to 7 days of treatment discontinuation. Usual adult dose for amenorrhea: 2.5 to 10 mg orally once a day. Duration of therapy 5 to 10 days. This drug should be used when the endometrium is adequately primed with endogenous/exogenous estrogen. Withdrawal bleeding typically occurs within 3 to 7 days of treatment discontinuation. Usual adult dose for contraception: 0.35 mg orally once a day. This drug should be taken at the same time each day. Usual adult dose for endometriosis: initial dose 5 mg orally once a day for 2 weeks. Maximum dose 15 mg per day. The dose should be increased by 2.5 mg per day every 2 weeks until 15 mg is reached. Treatment may continue for 6 to 9 months, or until annoying breakthrough bleeding demands temporary termination. Usual pediatric dose for contraception: postpubertal adolescents under 16 years, 0.45 mg orally once a day. This drug should be used after menarche occurs. The dose should be taken at the same time each day. Contraindications: known or suspected pregnancy, undiagnosed vaginal bleeding, known, suspected, or history of cancer of the breast, active deep vein thrombosis, pulmonary embolism, or history of these conditions, active or recent, e.g. within the past year, arterial thromboembolic disease, e.g. stroke, myocardial infarction, impaired liver function or liver disease, as a diagnostic test for pregnancy, hypersensitivity to any of the drug components. Warnings: you should not use this medicine if you have undiagnosed vaginal bleeding, breast cancer, liver disease, or a liver tumor. You may not be able to take norethindrone if you have ever had a heart attack, a stroke, or blood clot. Do not use if you are pregnant or trying to become pregnant. In some cases, you should not take norethindrone if you are nursing. Norethindrone side effects: get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Norethindrone may cause serious side effects. Call your doctor at once if you have sudden vision loss, bulging eyes or severe headache, swelling, rapid weight gain, unusual vaginal bleeding, missed menstrual periods, pelvic pain, especially on one side, a breast lump, a lightheaded feeling like you may pass out, increased thirst, increased urination, liver problems, loss of appetite, stomach pain, upper right side, dark urine, jaundice, yellowing of the skin or eyes. Signs of a blood clot, sudden numbness or weakness, problems with vision or speech, chest pain, shortness of breath, swelling or redness in an arm or leg,